Amanda. I'm Dr. Amanda and it's time for another Medicine Monday, where the aim is to educate, empower and equip you with the knowledge that you need to live your healthiest life. Today we're going to be talking all about sickle cell disease. In April 2019, a 21-year-old black young man by the name of Evan Smith died in a London hospital. He was a man suffering from sickle cell disease and had gone into hospital with a sickle cell crisis. Due to the lack of help he was getting and the kind of bed space that he'd been put into, to get help he resorted to calling 999 from his hospital bed. And from complications of that visit to hospital, that admission to hospital, he later died. This story is one that is so sad to hear. And when this year they did an inquest into Evan's death, a lot more of the details were released and it became more public knowledge. And it's just something that I saw, I read, and I've heard discussions about, and it breaks my heart to hear that things like that are still happening now. That people with sickle cell disease still aren't being treated in the ways that they need to be treated and believed when they need help. In addition to Evan's story, to Evan Smith, there have been some other things in public knowledge about sickle cell disease recently. And so I've been hearing a lot of conversation around on the internet, in the media, about sickle cell disease. And it's a really important conversation, but I can still hear that there's still areas of education that needs to be had. It is a disease that is well known and well documented, but the dissemination of that knowledge to the workforce, the healthcare workforce, and also to the general public as well, does need some improving. And so in today's video, it's just going to be a brief overview of what sickle cell disease is. If it's something that you've heard about but you don't know much about, or you've never heard about it before, then this is a video for you. Sickle cell disease is actually so common. Around 270 babies every year in the UK are born with sickle cell disease. And I think it's 1 in just over 70, I think it's 1 in 76 babies every year in the UK have the sickle cell trait. So it's really common disease and it's something that we should all be aware of. So let's start off with the basics. What is sickle cell disease? Sickle cell disease is a disorder of the red blood cells that live in our bloodstream. Now the red blood cells, they have a protein called hemoglobin that gives them the red colour and also carries oxygen around the body. And that is the particular protein that has the fault in when somebody has sickle cell disease. Now, sickle cell disease isn't something that you can develop over time. It's not contagious, you can't pick it up. It's a generic inherited disease. It has to be passed on by both parents to their child, and that's how they develop the disease and the symptoms and complications that go along with it. Anyone can be affected with sickle cell disease, although it is more common in African and Caribbean backgrounds. However, it has been found in the Mediterranean, in the Middle East as well. It's a lifelong condition. It's something that will affect a child from birth. Usually the symptoms don't really manifest themselves or start until 6 months, but it's something that we have to be aware of right from the start of life. There are possibilities for cures. There is bone marrow transplant, which does offer the possibility of a cure. However, finding a match is extremely difficult and so often isn't an option for many people. So what happens in sickle cell disease is that the red blood cell, which is usually a disc shape, in certain environments in the body, especially areas of low oxygen or when the red blood cell has given up its oxygen, those circular cells will change into a sickle-shaped cell. Now, these sickle-shaped cells are very sticky and they can get trapped inside small blood vessels. And those things, the stickiness and the getting trapped is often what leads to the common symptoms of sickle cell disease. The first symptom is pain, severe pain, what we call a sickle cell crisis, where the blood cells get stuck into a certain area of the body and the patient or the person with sickle cell will start to experience a lot of pain, whether it's pain in their legs, their back, their chest, depending on where the blockage is happening. There are many triggers for a sickle cell crisis to happen. They can be very simple things such as the temperature changing, being dehydrated, being stressed, having an infection, or being in high altitude are some common triggers. Now, these painful crises, they can often be dealt with at home. People with sickle cell, they really become experts on themselves, on their body. As you can see, the triggers that cause sickle cell crises are very common things, sometimes things that are really hard to avoid. And so being in pain often becomes something that happens quite regularly for someone with sickle cell disease. And so they become experts at their own condition and what they need. Sometimes they can manage these crises at home with certain painkillers and hydrating themselves, but a lot of time it does lead to hospital admissions where they need rehydrating and some very strong painkillers because the pain is extremely severe. When you see someone with sickle cell, that's especially ones that have had it for years, they may not show outwardly what we would expect to see with someone with severe pain. So they may be able to speak, or they may not be shouting or screaming in pain or writhing around, but we have to believe them when they're in pain because the severity that they feel is immense. And so often very strong painkillers are needed, such as morphine, and it's something that we've got to, as healthcare professionals, believe our patients when they tell us about. The second most common symptom or main symptom of sickle cell disease is anemia. Because of these sickle cells, when they change into that shape, they're actually much more fragile. And so rather than lasting the usual 3 months that most healthy red blood cells last, they don't last quite as long. And so the patient often becomes quite anemic. And so part of the usual routine for someone with sickle cell disease is having regular blood transfusions. Often they will have exchange transfusion where they take out the bad blood and put in all the good blood, but a blood transfusion is part of the way of life for someone with sickle cell disease. So in addition to these two main symptoms, there are a number of complications, quite serious ones that go along with having sickle cell. These can range from the acute chest syndrome that comes along with sickle cell to bone damage, organ damage, strokes, blindness, priapism, which is where you have an erection that won't go down. It really is quite a significant event if any of those things, a life-changing event that would happen if any of those things were experienced by someone with sickle cell. And so the main aim of treatment for sickle cell disease is to try and prevent and also to try and treat any complications that do arise, to allow the person to have as full a life as possible. There's a few ways to find out if you have sickle cell or you have the trait of sickle cell. You can either ask your doctor for a blood test, go to your GP and say, I want to know what my sickle cell status is, and they can do some simple blood tests, send it to the lab, and within a couple of weeks you'll know the blood results. Also, there are some times where everyone is checked for sickle cell. So at birth, at 7 days, there's something called the heel prick test, which is where the health visitor will come to the house, or if you're still in hospital, it'll be done there or by one of your midwives, and they take a small blood sample from the heel of the child. That's sent off and it tests for lots of different disorders, including cystic fibrosis and other things, as well as sickle cell disease too. The other time where sickle cell is routinely tested for is at pregnancy. And so any pregnant woman, when they go in for their booking bloods, sickle cell disease is checked then as well. Now, the prognosis of sickle cell, I think a lot of the time, especially in the past, when sickle cell wasn't understood as much, wasn't as detected as much, the life expectancy with someone with sickle cell was very low. Often people die in childhood or would only get to early adulthood. I myself, in my family, we do have sickle cell in the family, and I know some of my grandparent generation, some of their siblings passed away at very young ages. And although they weren't known to have sickle cell at the time, looking back, we can see that probably was the case. So I wanted to explain how sickle cell disease is passed along through the generations. It can sometimes be a concept that's hard to understand, and that's why I'm using a bit of illustration with some grapes and some blueberries. Now, every individual, when they give their genes to their children, there are 2 genes that they have that they can give away. And so, if you imagine this is the dad and this is the mom. Here, if we imagine that the healthy gene is the grape and the unhealthy sickle cell gene is the blueberry. Now, as you can see here, this example of mom and dad, they are all grapes. They have no blueberries, and that means they can't pass anything along to their children. Now, if you imagine the first scenario, well, one parent has sickle cell. So all of the parent's genes are blueberries rather than being grapes. This parent has sickle cell and this one does not. If we see now what they can pass on to their children. So one healthy cell would come from this parent and one sickle cell from that one. Another healthy one from this parent and a sickle cell one from that one. Another healthy one from this parent, a sickle cell one, and so on. As you can see here, in this scenario, to have sickle cell disease, you've got to have 2 of the sickle cell genes. Now, because one parent does not have any sickle cell genes, it's impossible for their children to have sickle cell. But all their children would have the traits because the parent with sickle cell can only pass on a sickle cell gene. Now, with this, the difference between trait and actually having sickle cell is that those with the trait often don't have any illnesses. They can usually live a normal life, and only in very stressful situations, such as very high altitude, might they actually have disease. But because they do still carry that gene, they still have the potential to pass on that gene to one of their children. Now let's see how this changes if the sickle cell parent actually has a child with somebody that has sickle cell trait and is just the carrier. This row would look exactly the same, but this row would change like this. And so you can see now that there's a 50% chance that the children will have sickle cell and a 50% chance that they would just have trait. Now this doesn't mean that if this couple has 4 children, 2 of them will have sickle cell and 2 of them will have trait. It actually means that each individual child has a 50-50 chance of having sickle cell and having trait. They could go on to have 4 children and they all have sickle cell or they all have trait. Now let's change it to both parents being carriers. The way in which this would change is that this would look the same, this would look the same, this would look different, and this one would look different. And so now, if 2 people with traits go on to have a child, which is often the scenario, and that leads to it being passed along the genes, is that you have a 25% chance or a 1 in 4 chance that your child would have sickle cell. There's also a 1 in 4 chance that your child would not have any disease at all. And then there's a 50% chance, a 2 out of 4 chance, that the child would go on to carry the gene. Another scenario is that somebody with trait goes on to have a child with someone that is healthy. Now in this scenario, once again, the child cannot have sickle cell, but there is still that chance that the sickle cell could be passed down. And this is mean that there's a 50% chance that the child would have trait and a 50% chance that the child would have no sickle cell illness at all. Now I hope that was made clear to you. The only one that I haven't shown is if the parents both have sickle cell. This one is quite a rare combination just because both individuals are usually aware of what their status is and they may not choose to go on and have children. But in that case, the only genes that are possible to be passed on are sickle cell genes. And so there's a 100% chance that their child would go on to have the disease of sickle cell. A lot of medicine has changed now. We've got a lot more information at the moment. And so the life expectancy for someone with sickle cell has increased loads. And even right now, I couldn't give a good number because we're getting so much more education now. So that a child being born with sickle cell now is often going to live decades and decades. Now, I know people in my personal life with sickle cell. And although in the past it used to be this sentence to this really difficult life, I'm seeing people with sickle cell really thriving. Sickle cell does not affect the brain. It does not affect somebody's ability to understand or their cognition or anything like that. They're still intelligent people with dreams and aspirations and the abilities to do things. I know people that are teachers, dancers, I know people that are doing sport with sickle cell disease and that are really achieving great things. And so the prognosis is not what it used to be. Now, there are 2 things that you can do in terms of improving care and understanding of sickle cell. And the first thing is to know your status. If you don't know it already, make sure you go to your doctor, get a blood test done, and know yours and your family's status. If you're in a relationship, it's really good to know your partner's status as well, so you're able to prepare for what the future might hold. The second thing to do is to donate blood. Like I said, one of the most common symptoms that are part of sickle cell disease is anemia, people with sickle cell disease need blood transfusions. And as the majority of people with sickle cell are black, often the best match of blood that they can have is from somebody from their same ethnic background, black people. But unfortunately, you know, the numbers of black people donating blood are really low. And with recently in 2021, since all these things, the news have come out about sickle cell disease, there has been a big uptake in people from black backgrounds giving blood. But if you haven't already, if you haven't signed up, if you're not a blood donor and you haven't done it before, please donate blood. It really just takes a small amount of time in your day, and more people than you think can donate blood, so give them a call. I'm going to leave just down here how you can register to donate blood and give blood, and it really can save somebody's life. So that was sickle cell. As I said earlier in the video, people with sickle cell, they are experts in their condition because they deal with it every single day. And so to understand sickle cell more of the whole, I wanted to speak with one of those expert patients, somebody with the disease themselves. So please come back next week where I'll be speaking to a lovely woman who has children, has a lovely family, and she has sickle cell disease. And she's going to be sharing with us her experience of healthcare, her experience of planning for a family, or dealing with sickle cell. So it's going to be a really interesting chat, something that will help to educate us all and have a bit more awareness. So thank you for watching, and I'm really hoping to see you next week.